The first question that we have was, how has treatment evolved over the years? I know you and I, Amanda, have been working in the field for about a decade, and you've almost 2 decades, right?
Almost 3.
Almost 3, wow.
Not to date myself, but yeah.
You just
I
did.
know, I feel really old.
You just dated yourself. So yeah, if you want to start actually, because you've been in the field the longest.
So, I mean, historically, obviously, there's a ton of changes that have happened, forgetting when I've been in the field, but, you know, mental illness, addiction used to be treated in sanitariums. I mean, they used to lock people up and they would treat it like you're a danger to society. Some of the craziest things that you would think of to try to treat people that weren't based on anything we know now with modern day medicine. And it was all just random. So now we know that treatment can be evidence-based. And I've seen a lot of changes even in the time that I've been doing treatment, from, especially my background is in mental health and addiction. So working in treatment centers, we see a lot of thought towards evidence-based, treatment. The brain disease model of addiction became much more popular, where people understood that this isn't a moral choice to just be an addict, quote unquote, but someone that needs help, that has a disease that's based on a medical model, a medical approach. Yeah. And then all sorts of scientific developments have come out of that. Medication-assisted treatment, better psychopharmacological remedies, and better treatment modalities that have emerged over time to help people to get better, and also hopefully to make it a lot less stigmatizing.
I first was in my first program when I was 14 years old, and I come from a traumatized childhood, childhood trauma. They tried to do the beat you down till you build you up. Mm-hmm. I was already beaten down a ton. That did not work for me, and that was not conducive for someone like me. And so I completely bucked that system. Now, the way that adolescent programs are like evolving to today, if I was approached with love and understanding, and someone heard what I had to say, like I see the shift in the treatment going today, I could have had a chance to change my life and much younger. But that's the way it was back then, and it was beat you down till you build you up. I was already beaten down enough. No one needed to beat me down anymore.
And I think a lot of that model of the shame from the confrontational approach came from, there were a lot of changes in society politically where they said, this is a war on drugs. We're going to criminalize people that are using, not look at, maybe there's underlying mental health reasons, maybe they're self-medicating for a reason, but we're just going to punish you if you use substances, as if this is a moral failure on your part.
Right. And going through childhood trauma from 4 to 7, I did not consciously say, let me try to find things outside of myself to make me feel better.
Right.
Let me hurt myself because I'm in pain. Let me become, a complete, disturbance to everything in my life and cause all. I definitely didn't choose that path for myself, right? And that's what people were saying, this is a choice. Well, no, that was not a choice. That was how I survived what I was going through.
I was even thinking, and there, the client that we're dealing with and some stuff going on, where how we're approaching it is, wow, yeah, this person is so traumatized that they can't control their behavior, or they're so traumatized that they're running from therapy, as opposed to what I think it would have been 10 years ago when we got in. This person's acting like an asshole and they don't want help. They're refusing to get help. They're making the decision to buck the system, as opposed now we're looking at it from that other angle, that this person is so scared of getting better. They're so scared of facing those demons that they can't bear the thought of getting help, because it's going to force them to uncover some of that deep history they have.
And so now we take time. A good treatment center, if someone gets to that level of care, takes time to do a proper assessment. It's not a one-size-fits-all mentality that this is how we're going to treat you, everybody's the same, but they're actually going to do a proper assessment, maybe talk to some family members also, people around the person, get an understanding of what are all the components that have led to the suffering that's going on now.
I would say that's probably the greatest change, is that it's not a cookie cutter model of treatment anymore.
I would agree 1,000%. Most programs now are coming from a therapeutic approach or trauma-based approach or whatever. It's a therapeutic program with components of different support groups and support networks.
Yes.
Not just 12 steps.
Yes. You have choices today. You can have a say in your treatment. You have choices to choose your aftercare, what you connect with and what you align with. It wasn't like that before.
It's a little less conformist than it was before, right?
Yeah, I think that's part of it. I think part of it's human nature. I think that, back then I wasn't in today's time, right? But I felt that way. I think that we've evolved to meet people where they are and, hear, okay, well, this is working for millions of people, but what about all those people and these low success rates? What about those people? Let's try to reach them too.
It's funny, like 10 years ago, it was a big deal to say you were a treatment center that offered individualized care. And now it's like, no shit, you better offer individualized care because you're never going to get anybody better unless you're doing that. You got to really focus on each individual person, figure out what's going on with them, and treat those issues specifically.